All right, so we're just going to give everyone a minute to join the live. So just taking that time to let everyone get set up and get ready, but we are going to talk about normalizing newborn sleep today in the prenatal and postnatal Facebook Live series. So just a moment will be given to make sure that everyone feels ready to go. And what do you guys think? Maybe a minute or two or a bit longer before we get started? All right, so I think we will do the land acknowledgement to start. So just before we begin, we would like to say the land acknowledgement. We would like to acknowledge that the land on which we are hosting this webinar is the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Dish with One Spoon Wampum and the Two-Row Wampum Agreements. These agreements established relationships between nations for harmonious coexistence based on respect, kindness, and acceptance and stewardship of the land and the resources to ensure that all people benefit and thrive. Today, this gathering place is home to many First Nations, Métis, and Inuit people. Acknowledging this reminds us that the great standard of living in Niagara is directly related to the resources and friendship of the Indigenous people. All right, so hello viewers, and thank you for joining us for our prenatal and postnatal Facebook Live series. My name is Victoria, and I'm a public health nurse at the Reproductive and Child Health Program here at Niagara Region Public Health. And today we'll be talking about normalizing newborn sleep. I have been a public health nurse for a little over a year now. And before this, I worked in pediatrics, postpartum, and neonatal ICU as a nurse. We also have Amanda here, who's one of our public health nurses in the Healthy Babies, Healthy Children's program at Niagara Region Public Health. Amanda, are you able to tell us a little bit more about your professional background and current position?
Yes, thanks, Victoria. Hello, everybody. So as Victoria mentioned, my name is Amanda. I'm a public health nurse with the Healthy Babies, Healthy Children program. I have been a registered nurse for about 7 years, and I have a passion for learning about biologically normal infant and toddler sleep and perinatal mental health.
Awesome. Thank you, Amanda. And we also have Cindy joining us. Cindy is one of the public health nurses in the Child and Reproductive Health program as well. Cindy, are you able to tell us a little bit more about your professional background and your current position?
Yeah, hi everyone. So again, as Victoria mentioned, my name is Cindy and I am one of the public health nurses in reproductive child health. I am currently part of our infant feeding reach team, as well as help to facilitate our sleep workshops. I also work on Niagara Parents with our phone and live chat options. And then prior to this, I worked in the NICU for almost 4 years.
Awesome. All right, so thanks, Cindy. And before we get started, I would like to just go over a few reminders. First is that the live stream is only for educational purposes. If you have specific questions regarding your health or your child's health, please contact your healthcare provider. If you have any questions throughout the live stream, you are welcome to put them in the chat section and members of our social media team will pass them along to us. If we're unable to answer your questions here, we do ask that you reach out to Niagara Parents. Niagara Parents has public health nurses available to answer questions by phone, email, live chat, or by sending us a Facebook message Monday to Friday, 8:30 to 4:15. This presentation will be recorded and will be available for later viewing on Facebook and on YouTube. We will share the links to resources that we may mention throughout the presentation in the comments section. And again, we'll be talking about newborn sleep today, and the questions will be answered at the beginning of the live, were ones that were submitted earlier, and we'll also answer commonly asked questions from parents that we get. Without further ado, let's begin.
Okay, so I'll start. There was a question that we received earlier today, and the question was, my friends have warned me that the second night at home has been the hardest for them, and I'm just wondering why is that? So I'm going to pass this one off to Cindy, can you answer that one for us?
Yeah, of course. So first of all, congratulations on your newest edition. It's a really exciting time for you and can also be really stressful when people warn you about what to expect in the first few days. So you may have heard about a baby's second night and how it can be a really trying time for parents. And so the second night is actually when the baby realizes that they're not in the comfort of your womb anymore. They aren't hearing the familiar sounds of your heartbeat, your other organs. Now they're wearing clothes, diapers, and seeing bright lights and different sounds. And so, with all the changes happening, it's really normal for your baby to cry and be a little bit more restless. So, some things that you can do to help during this time is to hold your baby skin to skin as much as possible. Breastfeed your baby often because they'll want to be close to you, and keep your baby's hands free of any mittens or swaddles so that they're able to self-soothe themselves. So just remember that this is a normal transitional time for you and your baby. So just enjoy all the snuggles that you can.
All right, thanks for answering that. Sorry. Thank you for answering that, Cindy. And another question that we get frequently is, my baby only sleeps while I'm holding him. What should I do? And I will pass this one off to Amanda to answer for us.
Yeah, thank you. So I just want to start off by saying that this is very normal infant behavior. So babies like and they need to be close to their caregiver. So we often hear things like they don't like their crib, etc. But it's not actually the crib or the bassinet that they dislike. They just don't like the separation from you. So we know that babies attach to their senses in the first year of life, meaning if they can't hear you, feel you, or smell you, their alarm bells start to go off. So contact sleep can be really helpful because what they're trying to tell you is that you need to rest too. So just make sure that if your baby is sleeping on you, that you are also awake to monitor. This can be a great opportunity for skin to skin and, like I said, some rest for yourself. However, if you do need to use your hands or have your hands free, you can try using a properly fitted carrier. And as far as nighttime goes, or when you need a nap for yourself, the safest place for your baby is to sleep on their back in the bassinet or in their crib. And the bassinet or crib should be near you for all sleep, set naps, and nighttime for up to 6 months or the first year if you can. With that being said, we know that having a baby that needs a lot of closeness and contact for sleep can be exhausting. So if there is a chance that you might bring your baby to bed with you, then just check out the Safe Sleep Guidelines and refer to the information for reducing the risks of bed sharing. Or you can call us at Niagara Parents for more support. And we just want to add that sleeping unsupervised together on a couch or a sofa is never safe. So just be aware of that as well. And it's really important to pull in as much support as you can during this time so that you can protect some sleep for yourself. If you feel that you still need more support or assessment, please call us at Niagara Parents so we can consult with you at an individual level if needed.
All right, thanks, Amanda. And our next question is, my friend's baby is 2 months and sleeps for 6 hours through the night, but my baby does not. Why is that? And Cindy, are you able to answer this one?
Yeah, of course. So this is a common comment that we get and that many parents ask themselves. So it's really easy to compare yourself and your baby to your friends, family members, and even people on social media. And so the most important piece to understand is that every baby is unique and their own person. And a baby's personality and temperament can really affect their sleep, as some may sleep longer stretches, while other babies might wake up frequently. But just to remember that it is healthy and normal for babies to wake up during the night to feed. So I hope that answers your question. We also received a really great question from Amy earlier, and Amy asked, my baby seems to have her days and nights mixed up. Why is this? Victoria, would you be able to speak on this a little bit more?
All right, and I'm sure this is a question a lot of people have. You're right, newborns can't tell the difference between day and night, and their sleep patterns are very irregular. This happens for a few reasons. First, the newborn's brain that helps their body's clock understand night and day hasn't matured yet, right? And then babies also need to wake frequently, even overnight, to feed. So those are two things that cause this. One strategy that we use is to highlight the difference between night and day as your baby's learning. And to do that, you would let natural light into your home during the wake times in the day, and you would keep the lights low and things calm at night. This sort of helps your baby understand that night and day are different. One other thing that you can do to help your baby get enough rest, regardless of if it's day or night, is responding to your baby's tiredness cues quickly. So you want to look for cues that your baby's tired. Examples could be rubbing their eyes or yawning. When you see them, you want to start preparing your baby for sleep. This will make it easier for your baby to fall asleep and will prevent them from becoming overtired. When babies get overtired, they become restless and they'll actually fight going down even if they need the sleep. I hope this helps you have realistic expectations of your baby, but remember, as your baby grows, their sleep patterns will change and develop. However, self-care is really important in coping with the sleep that you'll get while caring for a newborn.
Thanks, Victoria. Yeah, self-care is really important. Another statement that we hear often from new parents on Niagara parents is that their baby doesn't sleep for long stretches. Amanda, would you be able to address this?
Yeah, no problem. So babies under the age of 3 months, they wake often to meet their nutritional needs, and it's also protective for them as well. They transition from awake to asleep and spend about 50% of their time in active sleep. So active sleep will look like, you may notice they're making noises, kind of moving their arms and legs, eyes fluttering underneath their closed eyelids. And the other half of their sleep cycle is what we call quiet or slow wave sleep. And that's where you'll see your baby's breathing slow down and they're more quiet. The total time for that sleep cycle is about 50 minutes. So you may often find that you need to hold your baby for the first half of that sleep cycle until they're in a deep enough sleep to be put down. To know when your baby's in that deeper sleep, you'll notice, like I said, their breathing will be slow, they'll be very quiet. So you can also try, what I like is the arm drop test. So you kind of pick up your baby's arm and drop it. And if it falls limp, then you'll know that they're in that sweet deep sleep, and you can try transfer to the bassinet if you want. So remembering that total sleep cycle is about 50 minutes. So if after the transfer, they only sleep for another 20, 25 minutes longer, that's normal. Also, sometimes when babies are in that active sleep, we do think they're awake. So it's okay to pause and just see if they're transitioning to that deeper sleep. Obviously, if your baby's crying and not settling, you want to pick them up and comfort them. So we'll just say, trust your instincts here. And I believe earlier we also received a question about a 4-month-old who understands day and night, has a good routine, it was said, easily goes back to sleep when wakes, however, still wakes 1 to 3 hours, and they were asking for tips. I just want to say that based on the information that we just shared, that your 4-month-old still sounds very normal at this age. So I want you to know that you're doing an amazing job. Like, everything you stated sounds really good. And just know, between 3 and 6 months, we do see a change in sleep patterns, and babies tend to become more aware of their environment as well. And they do need more support than they may have needed during the newborn stage. So this is not a sleep problem, it's developmentally normal. And the next question was, when parents often think about newborn sleep, they may ask if they need to swaddle their baby to get sleep. So Victoria, can you speak on swaddling a little bit more?
All right, so that's a great question. And the short answer to if you need to swaddle a baby is no. Infants are safest when they're placed to sleep in a simple fitted sleepwear that's comfortable at room temperature and doesn't cause them to overheat. People may still choose to swaddle their babies because it calms infants or soothes them, or they think that it promotes sleep. The safety of swaddling, though, is debated. So if you do swaddle, you want to use caution. There are things that you can do to actually make swaddling a little bit safer for your baby if you do choose to swaddle. The first thing is that a swaddled baby should always be placed on their back. And when you swaddle, you need to be extra careful to wrap the sheet so that it doesn't cover the baby's mouth, their nose. Those all need to remain clear. And when the infant is wrapped, you want to make sure that it allows them to move their legs and their hips freely. You also want to make sure that the baby doesn't overheat, so you won't overdress the baby in the swaddle, and you'll hopefully use a lightweight blanket as well. You should also leave the baby's hands free of the swaddle so that they can show you when they're hungry as well. And then the last thing that we really want to highlight, and we hope that you remember, is that you should stop swaddling a baby once they show signs that they are trying to roll over, or a little bit before they are trying to roll over. We just hope that these strategies can help you if you do decide to swaddle, to make it a little bit safer. Of course, we want you to feel comfortable when you close your eyes at night to go to sleep.
Perfect. Thanks, Victoria. So now we'll answer any questions that came in through our live stream. So if you have any questions, feel free to put it in the chat. But I think we have one. So, okay, so does feeding formula help my baby sleep longer? That's a really great question. And Amanda, would you be able to answer this for us?
Yeah, sure, no problem. So this one is a myth. Feeding your baby formula doesn't guarantee that your baby will start to sleep longer stretches through the night. So no.
Perfect. Thanks, Amanda. We're just going to see if there's another question. Okay, so the next question I have here is, should I let my baby cry themselves to sleep? Victoria or Amanda? Amanda, did you want to answer this one?
Sure. So you never have to let your baby cry themselves to sleep. This would be a parenting choice that you would have to make. Babies, it's very normal for them to wake for the first year of life. Sometimes that isn't sustainable for the parents. So if you're having what you think is a sleep problem or a sleep concern, I would suggest reaching out to our Niagara Parents team for more information and have someone assess kind of what's going on in your home and see what's happening.
Thanks, Amanda. The next question we have is, I've heard about a white noise machine for babies. What does it do? Victoria, would you be able to let us know what a white noise machine is?
All right, so yeah, white noise machine is something that parents often use. It's, consistent noise throughout the night. You don't want it on for too, you don't want it too loud for too long, but it's something that can sort of block out any sudden noises or any changes in the background noise that might startle a baby awake. One thing that we'll note is that babies, when they're younger, they'll spend a lot of time in light sleep, so they're actually very easily startled. So making sure that you have consistency in the noise level and the lights that you use overnight is very important at that age, and it continues to be important as they get a little bit older. So yeah, for some babies, it will actually help them to sleep for longer, but some babies do prefer a quiet environment, so sometimes you have to play it by ear.
Alrighty, so the next question will be our last one. So the last question is, my baby is colicky. Are there any helpful tips? Amanda, would you want to answer that one for us?
So colic is defined typically as crying for three more hours a day, more than 3 days a week for more than 3 weeks. And I would say that colic is a symptom of something. It's not necessarily a diagnosis. So if you are having this happen, or it's been diagnosed by your doctor, or you've been told that your baby has colic, I would go back to your doctor, or you can call us at Niagara Parents Speak with the Nurse to see if we can investigate further what might be causing the symptoms and kind of the discomfort that your baby's experiencing. That's something you do not necessarily have to wait out. We can kind of see if there's a reason for that. I'm so sorry you're going through that. That's really hard.
Alrighty, thanks, Amanda. Okay. I think we had a last minute one that possibly came in. I'm just going to, I know I said the last one was the last, but maybe give me 1 second. Okay, so, and I think this is probably speaking to one of the questions that we kind of answered earlier, but my baby is 8 weeks and will sleep 3-hour stretches at night, but will not sleep alone during the day. I often have him in the carrier. Are there any tips? So I'm not sure if that was Amanda or Victoria. One of you had spoken on that earlier. I believe it was Amanda, but Victoria, if you wanted to add anything to that.
Yeah, so we just, so 3-hour stretch is really good, and they don't have that day and night kind of like we mentioned as well developed yet. And it is very normal for your baby wanting to be close to you and near you. So you can use that fitted carrier. Take time to rest if you can. I know sometimes that's easier said than done. So if you have a support system, start calling on them, bringing them in to kind of help you so that you can kind of get things done, or delegating chores so that you can sit and bond with your baby. Those are the tips I would recommend. Victoria, do you have anything to add, or did I cover it?
No, I'd say that.
Yeah.
Sorry, we have a little bit of feedback. I would just highlight that, at 8 weeks, we're still hands-on settling, and really we're still in there. And I'm sure as a parent, you're still in there. So just know that you're doing an awesome job when you're really hands-on and you're responding to those cues. And as you're settling your baby, they're actually learning how to soothe themselves as well, right? They're getting the understanding. And as they get a little bit older, you can start to sort of transition them to sleeping in the crib, using the hands-on settling with them in the crib. But again, yeah, very hands-on at this stage, and it's very normal what you're describing.
Perfect. Thanks, Victoria and Amanda. So I just want to thank everyone. Thank you so much to our viewers who joined us this evening. We had a lot of great questions come through. If we didn't get a chance to answer your question today, or if you think of additional questions, please just send us a message on Niagara Parents on Facebook. You can also live chat us or call us at Niagara Parents. And just as a reminder, we do have a few videos that will be released next week, which will speak to pregnancy and infant loss, how to receive support and help for yourself and your partner. So keep your eye on our socials for release dates.